So I'm 35 years old, so about as old as functional medicine, just a little bit older. But for you, Jeff, you're 30 plus years in functional medicine and even more in the world of medicine and science. If there was one thing that you could have done differently in your path, what would that have been?
Oh boy, that's such a great question. And first of all, Dr. Robinson, I want to tell you how privileged I am to have this conversation with you and have people like yourself coming into this field. It's the greatest honor and kind of what I'm going to say, testament to what we were trying to do some 30 years ago to get people of your skill and background and commitment and authenticity to be part of this concept. So thank you. Now, with that said, let me, if I can, talk about me personally as it relates to the tortuous path of a life experience because it's never linear. As they say, life is what happens in between your plans. And so for me, if I go back and say, what might I have done differently? Um, I know this sounds trite, and to some extent, maybe it's superficial, but I would have not have changed anything. I've made mistakes and decisions, and I've had things that, for the moment, were considered maybe with some anxiety, uh, bad moments of experience in life. But if I look at them in the context now of a 75-year-old and try to really evaluate the topography of my life, they all had a purpose and they all fit together and they all assemble a story that for me is something greater than I would have ever thought when I was a high school student wondering where I was going to go with a probing mind and a lot of kinetic energy and not knowing how that might translate into the world. And so I don't want to be superficial in my response because it's a very serious question, but um, everything that I have ever experienced that I would consider to be a negative, both from a social side as well as a professional side, in the context of my life now, I would say fit into a very important part of the purpose of what I'm all about. And I could talk about specific experiences both from my social life and things. For instance, having lost our second son to sudden infant death, some 2 weeks after I took my first job into a new town and just finished my PhD work. And I've often wondered, if I would have done something differently, would he have not, he'd still be with us. He'd be 51 years old this year. Um, but in the context of the unknown of life, which is always uncertain, there's not a day that's gone by since his passing that I haven't thought about and made it purposeful as to what I wanted to do. Because I've always thought if I could help one set of parents or one child to avoid what we went through, it would be a life well served. So I think all of these things kind of fit together in some strange way to be the topography of how we travel and who we are. So that would be my long-winded answer to your very insightful question.
Oh, I love that. It's a question I've asked myself quite a bit on my journey as I've struggled with finding my unique place in medicine. And functional medicine definitely has been that home for me. But there still have been moments along the way in the past 4 years of being in functional medicine where I'm like, oh, is this really what I want? And so hearing from you, and the part that really resonates with me is you sharing how everything served a purpose. And in my life, that's been so key. Every moment of distress, every time that I've hit that wall, it's enabled me to serve somebody else who's experienced something the same, or it's allowed me to share that story from an empowered position to somebody later and just encourage people and let them know that we can still show up, we can still be in that realm of unknown and not having it all together, but still be of high service to the world. And you definitely have been one of those pioneers in so many ways and shed such a bright light for people like me. And I'm just so grateful for all of your contributions.
Well, thank you. I think you said some really important things there. And I just take away from your thoughts that you're guided by a certain personal mission that you've got in your life. It probably started very young, I would imagine, and where you'd like your life to go as a woman of authority and a person who is going to make contributions and seek out your way of performing your art as a human being. And so you chose medicine. Wasn't necessarily the easiest path, probably, but it was a path you chose that would test your skills and allow the best of you to be to emerge. And if I look back and use a similar kind of perspective on my own life, what I would say is that each day you try to ask yourself the question: are you serving a purpose that's somewhat consistent with what you thought your life might be, as a meaningful exercise, and knowing that it's always uncertain. There is no kind of absolute truth. There is no perfect decision, and there's no one path to enlightenment. But are you generally, as we kind of go around up and down the tortuosities of life, are we staying on that principle that guides us, whatever that GPS coordinate is for our life? And if you can say over time that yes, you are, and part of your learning experience is to see, because you get to a point where, oh, I'm a little bit uncomfortable with where I am now, so I need to pull it back in because I'm straying too far away from where I really need to be. And I had a really interesting conversation. This would be now over 4 decades ago, when I was a new professor, and I was doing some consulting, and a person I was consulting for, the CEO of the company, was a very sage guy that I really respected. And I was going through this kind of early career internal debate with myself. Was I doing the right things? Was I pursuing the right things? Would it take me to the right place? And he kind of metaphorically grabbed me by the shoulders in this conversation one day, and he said, "Whoa, just a minute, Jeff." He said, "I've gotten to know you well enough to know what your mission is and who you are and what your vision is as a human being. And I need to tell you, you need to stay right on that path, because if you stay on that path and you don't get deflected and you don't follow siren songs that take you away from what you know is right, when you evaluate at the end of the road how you've gone, you'll be in the right place. So just keep staying on your mark." And I've reflected on that so many times, because stuff comes up like, oh, this is opportunistically sounding really good, and if I did this, it would take me over here, but maybe I could rationalize why I'm doing that because it had some marginal benefit in the moment. But then you come back to your guidance principle and say, no, hold it, that is actually not consistent with where I want to be, because we know that if you hit it, you're aiming a laser at the moon and you miss by a couple of degrees, you won't even hit the moon. So you have to stay on your mark. And so that kind of principle has really guided me, and I think it's been part of actually the origin of the Institute for Functional Medicine and the functional medicine concept. Because when Susan Bland, my wife, said to me one day when I was speaking to her about all these marvelous people I'd met, because I was traveling a lot internationally and having a chance to visit with all these remarkable innovators, and she said, "Well, Jeff, why don't we just have this meeting? Let's host a meeting, and you can invite in these innovators from around the world, and you can sit down and just have a whiteboard discussion about what would healthcare be if you didn't have licensure and reimbursement, just what would it look like in an optimal situation." And that led us then into these Victoria, Vancouver Island, BC meetings back in the late 89 and 90. And the characteristic that I now look back on of the people that attended those meetings, there were about 35 people, shared the common thing of that vision about their lives. None of us knew exactly where we were going. The Leo Gallons, the Sid Bakers, the David Jones, the Graham Reedys, the Scott Rigdons. We didn't know exactly where we were going, but we had an idea what our mission was in life, and it was kind of a Venn diagram of overlap. And I think that synergy is what resulted in kind of the creative thought of me on that Saturday night of the second year we had the meetings to come up with a concept saying, let's call ourselves functional medicine. And it was really that kind of led to that. So I think that the creative spirit, if you unharness it and unleash it, because you're on your center, you're on your joie de vie, or whatever you would want to call it, can create magic outcome. That's how I see it.
One thing that resonated so much from what you said was, staying true to yourself, and that what I call that compass of knowing that we have this mission and this direction. But one of my challenges has been this sense of, a word you mentioned was right. That had come up a couple times, and for me, right is a challenging word because there's no right way of being a
Mm-hmm.
functional medicine doctor. There's no right way of doing a lot of things, yet there is a way that's more aligned, I would say, with the greater good and with a higher mission of serving humanity and our health. So, you know, how have you navigated? I don't know if you have that same struggle of sense of having to be right and get things perfectly, but how have you navigated that sense of, I have this vision, but then is this the right thing to do right now?
Yeah, thank you. That's another interesting personality inventory characteristic that we all carry with us. How much are we committed to everything being absolutely in order and perfect to the level that we feel we've done our best work at all moments, versus allowing some latitude, the 90% rule or the 80% rule, saying if I get 80 or 90% of the way right, that's going to be good enough for me. And I think that this is a very interesting internal guidance principle that I find is varied from person to person. I happen to be married to a very good partner now for 35 years that um, who is really a stickler for absolute detail and for perfection to the extent that it can be achieved, knowing that that word is a little aspirational. She's married to a guy who doesn't share that same degree of I'm a big principle person. And so we balance one another out quite well because she'll hold me accountable to the details, but I think I'm good for her because I keep pushing the envelope into some of the broader issues so we don't get bogged down on some of the details. But there is a compromise and a advantage to each of those, and there's a disadvantage if either one is taken to the extreme. So for me, as I've progressed through my life, I've tried very hard, to assemble myself with the right kind of people that can complement my strengths and weaknesses such that it doesn't allow my weaknesses to become a great liability. Because sometimes what we would find that our weaknesses become a strength in certain characteristics, and our strengths become a weakness in other characteristics. So it's finding how to take those talents or those gifts that we feel we have and embed them in the right environment with the right individuals around us that will call us out, but do it in a way that is always coming with the right intention, right? Always coming from, I'm just here to help you be the best you can be, and here's a thought. And so it's kind of avoiding heat-seeking missiles, which are attacking the person. You're just kind of attacking, or not even attacking. You're really bringing up ideas. So I think that when we started off with the Institute for Functional Medicine, the original founding group, which was a small group, it would be a large family in today's language, all shared that kind of commonality. We had different textures of perfection. Dr. Bob Learman, who had come over to us with an MD, PhD, and being a senior faculty member at Boston University and his PhD in nutrition from MIT, was and still is a stickler for detail. I mean, he was an absolute perfectionist. And so he helped us in the original curriculum development for the Applying Functional Medicine Clinical Practice program. David Jones, of course, was a clinician par excellence, and he recognized the uncertainty in clinical practice, but his concept was always to kind of nail it down as well as you could to reduce uncertainty, but knowing that uncertainty was part of the process of being a physician because it's not a perfect science, it's an applied science. And so I think we had different textures of personalities that all wooled themselves together with the view, and this was really Susan Bland's advocacy, that if we're going to form an organization, let's form the organization to be discriminating on commitment to excellence, not on discrimination based on backgrounds, ethnicity, gender, even degrees. Let's not make it degree centric. Let's make it excellence centric, for people are all aspiring to find a way to collaborate in creating a healthcare system that really delivers health. And I think when we set that up as a guiding principle for the organization, it really set us apart from many other organizations. Now, living that principle is always really the test, isn't it? Because you can say a lot of things, but it's how you really live it. What's your life's experience? And I believe that as I look back on the 30th anniversary of FACN, I'm very proud that going through many iterations of different people and bringing all sorts of different energies and much more variegated talent into the organization, that we've been able to maintain that sense, I believe, of the original kind of belief system as to what we wanted to do with the community that we were developing in functional medicine.
And so, I love what you said about the strengths and the weaknesses. Is one of the things that I thought was such a weakness coming into functional medicine, and I attended AFMCP as my very first course back in March of 2017. And I had an interesting journey where, I was in my residency, in my residency first year doing a transitional year program. Never really felt like I would continue practicing medicine. I was going through the motions and knowing that I had committed so much of my life to this, and I just have to keep going to whatever this endpoint is, until I reached my second year doing preventive medicine residency. And within 3 months, I was so burnt out that like I had to resign. Didn't know what I was going to do or where I was going if I even wanted to stay in medicine, period. But I knew deep in my heart that I had to have a home somewhere. There had to be some way that I could use my passion for health, as I didn't see health reflected in anything. I was like, I feel crazy. I'm passionate about this thing, which I feel should be the right way of doing it, the right way of helping people just be free and alive in their bodies. But I couldn't find that anywhere. So that fateful March 2017 at the AFMCP, I came in having a sense of, well, I'm surrounded by a bunch of doctors who've made it. They've had their practices, they've had full careers, and here I am. I'm a residency dropout. And oh my gosh, am I going to be able to make this work for me? And from the very beginning, I felt and one day I remember, I think it was Joel Evans who was leading a meditation and just being brought to tears in the sense of unity and acceptance and positivity that I had never experienced anywhere else in medicine. Like it was like, I was like, I don't know what Kool-Aid's going around here, but I am all for it. It's like, why can we have this Kool-Aid anywhere else? At my med school residency, it was beautiful. And it was, for me, I think, a glimpse into the future of what healthcare can be. Healthcare can be less about the titles and less about status and protocol and this having to be the way and huge corporations. It can be about the people. It can be about the humanity. And that's what I love, that you and the brilliant pioneers 30 plus years ago were able to have that foresight so that somebody like me could actually have a home in medicine and be able to serve in a unique way that allows me to have the balance that I want in my lifestyle and to serve people in a way that feels genuine and not forced and prescriptive, and still, have all the things in life that I want. So very grateful.
Well, it's beautifully stated. And I think you said many things, but I want to kind of summarize them into a theme for me. As I've kind of been in this field now for more than 40 years, I have come to recognize that some of the things as a younger person that I was very anxious about and maybe even to some degree militant about, the edges have been a little bit softened and smooth now. So my view now is that the disease care delivery system is designed to do what it does, and it's doing it pretty well when it's equitably administered and available. And that model is really built around a premise that you see a doctor when you are sick. And being sick means that you fulfill a certain criteria that have been fairly arbitrarily defined that we call disease codes or disease nomenclature. And that model in that tertiary care environment actually has worked quite well because it's spawned innovation, it's developed the economy to allow these tertiary care centers to develop. It's allowed philanthropy of people that want to help children that have cancer, and all sorts of things have emerged out of that model. So I never want to really be disrespectful of what's happened. But what I have come to recognize with increasing degree of clarity is that you can never, ever burr the healthcare system out of a disease care system because they're entirely different languages. It's not to say disease care systems are wrong. It's just if we try to put everything that's medicine together into one system, when the primacy is owned by disease, health is over here as a satellite and a subordinate that's tethered too closely to the disease system. So even if we think about health in the context of disease care, what do we really talk about? We talk about disease risk reduction. Well, disease risk reduction means you get some numbers like cholesterol or LDL or HSCRP to go down. But those don't track exactly with people's perception of health. So in terms of a disease care system that's looking at disease risk reduction, that model is all self-consistent. When looking at what aspirational objectives are for people to be healthy, it doesn't track. So you need a different system with a different set of objectifiable and quantifiable markers that allow you to define health in a different context than disease. And that's what we've been trying to do in functional medicine. We're not trying to throw any babies out with bathwaters. We're trying to say there's an equally objective set of tools that can be used to evaluate the functional status of an individual that tracks against their health, not just against their disease. And that model needs equal opportunity to be said to sit at the table and to talk about how it's going to deliver services to an unhealthy population that are seeking health, not just disease mediation. And I mean, look at the COVID-19 as SARS-CoV-2 is a good example. I mean, this disproportionate pathology that we see with medically underserved and people with social determinants of disease doesn't relate to the disease in and of itself. It relates to the architecture of the health that they possess before they're exposed to a SARS-CoV-2 virus, which then you don't get by just asking what's their disease risk reduction. You ask what is their general level of immune vitality associated with their health. So this is a whole different system that we're trying to teach, which if you use the capital M medicine encompasses all of those. Pharmacological or surgically based tertiary care medicine is a portion of that, but it's not the whole equation. And that's what we're trying to get people to understand.
Right. And, when I have the opportunity to tell people about functional medicine, most people are like, wow, that's amazing. Why haven't I heard of it? It's like, I feel like functional medicine we shouldn't need the functional in front of it. It should just be what medicine is. It's sad that we have to say it's functional, but no, it's great that it's functional. But given that our current system, I would call dysfunctionally functional, when people come about what we're doing, it's such an eye-opening thing for them to understand that here we have this beautiful way of looking at things, which is finally tangible for the patient. It gives them a sense of ownership. It gives them the ability to, have that active role in their care, which is totally lacking, which I got so frustrated in just from early on. I remember, shadowing doctors early in like high school and college and having a chance to talk with patients, and they just always seemed lost. They sat there quietly, not really understanding what was going on. And if I had a chance to chat with them, in the checkout process, and, usually they were asking me more questions like, well, I'm just a student or I'm just shadowing here. Like that would have been a great, but there's so much sense of, like, oh, well, I don't want to appear to subvert the doctor or question his authority or her authority, which what I love is like, I feel that functional medicine brings in that element of humanity that's been lacking. It brings that element of partnership and that element of really just love that's lacking in medicine in the world
That,
today.
that is a beautiful way to say it. And you're reminding me now of, I know this sounds a little bit trite, but it's actually true. And I'm taking up on what you were talking about in this conversation about the different ways of looking at medicine. So when I came back on the Sunday morning after having this divination about that we ought to call ourselves functional medicine, and I presented it to the group as a thought, I got a lot of pushback. And people said, "Well, Jeff, functional medicine already has terminology in the medical lexicon. It's either geriatric medicine or it's psychosomatic medicine. It's all in your head, and so it's kind of got a negative connotation." And then I said, "Well, there's two things that I was thinking about last night that I think would counterpoint that, because what you said is true. But here are my counterpoints. Number one is I follow the medical literature quite closely. And over the years, this would be prior to 1990, I saw a lot of articles that were starting to be published talking about functional cardiology, functional immunology, functional endocrinology, and I said, and functional radiology, because the new techniques were just coming on board with CAT scanning and the different imaging techniques that were functional. And so I said, maybe we're going to see the term change. Maybe we should skate to where the puck is going, not to where it is. So that was my first point. But then my second point, I said, so I also was thinking about all the things that we call this field, this field we're in: alternative, complementary, unconventional, holistic, with a W and with an H, orthomolecular. And I said, all of those terms are very confusing and off-putting to many people. So I asked myself, could you find a term that would not be off-putting, so everyone would feel some kind of a connection to it, no matter what their background was? And I said, in a group of several thousand health practitioners of different backgrounds and specialties, if I ask the question to that audience, all of you that are practicing dysfunctional medicine, stand up. How many would stand up? And of course, then I said, now, how many of you say you're practicing functional medicine, stand up? I said, most everybody would stand up. So maybe here's a term we can all use that is a meeting ground that doesn't put people off because it carries baggage with it, that we can redefine through this new concept of function as a precedent of pathology. So that was actually how the whole term functional medicine kind of emerged. And after I gave those explanations, the group said, well, okay, maybe it's worth a try. We'll give it a whirl. So that was what led then into ultimately starting the Institute for Functional Medicine. And then, of course, to add one last chapter to this, Susan Bland, a couple of years into it, said, if we're going to make this real, then we need to really go after ACCME certification so that we can produce accredited continuing medical education courses. And she was the first person to go to a ACCME meeting. This would be back in the early 90s, to see what was required to go through the accreditation process. And she and I actually had quite vigorous discussions with the group about this, because I didn't feel that was a good idea. I felt that going for accreditation would limit us to standards of practice and to get other people surveying what they thought was right in using the lens that they had of the disease care system. But the more we talked about it, the more we thought, no, if we're really going to be seen authentic and seen as kind of the masters of our field, then we needed to go and pay that price and go through ACCME, which we did successfully, and it's been ever since accredited since the middle 90s, or maybe the late 90s actually. But now we recognize that my concern was true, that you never get anything without a price. So part of the price is that we have to kind of make sure we play that game of usual and customary standards of practice, the ACCME guidelines, while we're also trying to build this architecture for a different kind of healthcare system. So it requires a very adroit group of people like yourself to try to architect this system around all these standards that maybe are going to change over time, but still become the kind of the letters of our land. So that's where we are today.
Yeah, and the word that comes to mind is hacking. We're all just kind of tinkering
Yes.
and pulling things together and figuring out how to make things work with our resources. Some of us have extensive resources to be able to employ in our practices, and someone like me, I'm a solo entrepreneur. I do everything from right here. I have a very small panel of patients. I do all the admin work, so I'm constantly figuring out how to make things work within the standards of medicine, but then all the boxes that I do have around me, but I'm always kind of tiptoeing along the edge of that box to see what things I can pull in that are going to support me and my patients outside of what the government and the big organizations think I should be doing and what is right. So it's a unique position to be in, but it's fun. And I like to say that, functional medicine has fun in the name. So it should be fun. It's a new and open approach that allows people to have, take a little bit more risks, at least on my side of things. I feel like I'm constantly pushing the envelope and my approach with my patients, and bringing in the newest and the latest is, if someone's suffering, if someone's in pain, if they're struggling, they're open to trying whatever. And so we have so much new research out there. And I mean, I'll admit I'm not the one reading every single article out there. I have the pleasure of working with a lot of patients who love doing research. So they're usually the ones bringing things to me saying, hey,
Mhm.
can we do this? Like, awesome, let's go for it. And so I think, just functional medicine being that, starting as a pioneering space, it's, attracting people of that same caliber, wanting to, see what's possible, and to, see, and, I'm really excited to hear from you. Like, what do you think the next 30 years in functional medicine looks like?
Well, I think that you said so much in that little unit that you just shared with us, because as I review back 30 years now to the start of the Institute for Functional Medicine, um, and this sounds like the old guard always talking about, well, you as the new people have it a lot easier than we did. But what I would say is back then, um, if you think about it, this was really pre-internet, pre-social media. Internet was just becoming something in the late 80s and early 90s. And so it had not totally revolutionized the whole practice of healthcare as it's done over the last 30 years. And so a lot of our early practitioners were really hidebound with models that would allow them to take their interest into other places other than just institutional medicine. And they really had to become mavericks and renegades to move out into functional medicine. Now, I'm not saying today that it's completely easy, but I think what we are witnessing, and part of this is even accelerated because of SARS-CoV-2 and the COVID-19, is the decentralization of healthcare. And as healthcare starts to become decentralized, moving out of the hospital-based kind of locus of control into the communities and into the individuals who are seeking out, just as you said, with your patients coming in with information off the internet that they were already knowing more about themselves than that doc would probably know normally, that this sets up a dialogue and an environment in where creativity and collaboration and new systems can be developed, new business systems for managing healthcare. And for those who are into command and control models, this is probably very unsettling. For those who like distributive systems that are collective and deal with the advantages of a collective system where you have expertise in different people that you can leverage to create an emergent new structure, this is a marvelous time, because now with virtual visits and with group visits and with all the information you can get off the internet and with new ways of finding reimbursement opportunities through the new coding, I think we're starting to witness for the first time what we had all been forecasting would eventually happen, would eventually become part of who we were as functional medicine if we could just have the system become more robust to allow creativity to occur. And I think it is. I think that is happening right now.
Awesome. Yeah, creativity. I mean, we can't have a civilization without creativity. We have to innovate. We have to keep moving forward. So, and I want to pose that question again as far as like the next 30 years in functional medicine. What do you think is possible? What new innovations? You are one of those innovators. So, what does the next 30 years for you look like?
Yeah. So let me start with a simple physical example. And this is in no way trying to sell a product or service, but just to use this as a representation. So I'm holding here my Aura ring, right? Yes, there you go. And I'm a biohacker. There's no question about it. I've had, I'm sure, over 50 different biometric devices that I've tested and tried. Um, all of these teach me one thing, and that is this device or these devices introduce a person to their body in a way that they didn't have before. They start to have a sense of ownership of their body when they can see these things. If you look at what continuous glucose monitoring tells us, wearing one of these devices on our, which now is going to be subcutaneous, just on a ring or a watch soon. We won't even have to put the device on our arm. That concept, and I know this is true because we did it in our own little group of 16 people. We all got a continuous glucose monitor, put it on our arm, and we did a month-long study among us. And some of these people were not in our group, were not medical people. They have other functions, but this was an observation of how they were introduced to this information about their blood sugar changing with their life experience. And it was an aha. I could see it in these individuals saying, oh my word, I had no idea when I was under stress that my blood sugar went up. I had no idea when I didn't sleep well that my blood sugar was affected, and on and on. I know this specific food, what impact it had on my blood sugar. So these tools, these biometric tools, are really just an example of this new way that we're going to introduce ourselves into how we own our body. And before, if you think about medicine, it's been built on the premise that when you're broken, you come on bended knees to a practitioner that saves you. You know nothing about your body. You're maybe alien from it, and you don't know how your life is influenced, how your body's functioning. It's all a black box of mystery. And now you deliver it over to some person that's going to repair it for you. As you get this information becoming real time and it goes to the cloud and it comes back through an AI algorithm and it teaches you about yourself on an iterative basis as to how you function best, how you get the most out of your genes, that is a transformative thing that's going to change all of the equation. It changes, and I can assure you, and you know this, every major deliverer of services and products in the disease care model is concerned about this because it will change the dynamics of much of the business environment. It distributes it into tech companies. It distributes it away from the primacy of the health and pharmaceutical industry. So I think what we're going to witness is a very remarkable transformation in personal health like we saw in personal computing occur in the 80s. I mean, how many people in 1978, when I got my first Apple computer, how many people thought they needed a computer? It was nerdy, right? It was like a game. It was like a hobby. But then we got spreadsheets and could start to do, different kinds of things like letter compositions and spreadsheet for financial management. And people started to see applications. And now look at, we can't even imagine a world without microprocessors and computer intelligence that are managing all sorts of things for us. So the same is going to hold true for healthcare. And the individuals, I believe, who are really at the forefront of what is health, not just disease, are going to be the recipients of this revolution. And so I keep saying to people, stay the course. I know some people have been coming to my seminars for the last 30 years, say, Jeff, you've been saying that for a lot of decades, but it really is accelerating and happening now. There's just no question about it. And when you look at where wealth is going, because you cannot generate a major social transformation without an engine to drive it, a financial engine. And the financial engine that's going to drive this is built around the new sector of companies that are emerging around health and not disease. And if you start looking at the trillions of dollars that are going into the emergence of new healthcare evaluative tools, it's going to be the wild card to change how we see medicine in the broadest big capital M of medicine. So that's how I see the future. And people will say, well, how long is that going to take? Well, as you know, the rate of doubling in this field is less than 3 years, and the rate of doubling is going down in time. So this is not geologic time that we're talking about. We're talking about real time in the course of certainly the life of my grandchildren. They're going to see a whole different opportunity for young women and men to come into healthcare, not just disease care. They will have an option as to how they want to travel in their professional life. And I think we're going to bring a lot of bright minds, intuitive and innovative spirits into the healthcare environment to create wealth around health, which will then help us to have a seat equal to that of disease.
Ooh. Oh, that's so great. That's the ultimate inspiring vision, to imagine a space where, there's that, more equality. It's not medicine ruling over, it's not tech. We have, every system coming together, marrying and supporting the person, because at the end of the day, it's about the person. It's about that human on the other side. And whenever we can have devices like our Aura rings, like I was just reflecting this morning, and it's always so exciting first thing getting on in the morning and seeing my readiness and sleep scores, and being able to support and coach myself and my lifestyle behaviors, and to think of being able to make Aura rings and tech like this even more accessible. Not everybody has $300 to spend on a fancy gadget like this to tell them how their habits are panning out. But like you were saying, like as technology and everything is growing so rapidly, I can imagine a world where these types of things are just as easy as picking up a new pair of sneakers at the discount store, and being able to have that access to, for all of us to be the active makers of our own health. And I think another key component is and what functional medicine does such a beautiful job around is education. When people have, and that's one of the things I love, getting to read the additional articles that Aura has or any of the other tech. It's being able to have that greater sense of understanding, because when we're educated around what we need to do, it's not a matter of having to go and submit to the almighty doctor. It's, oh, I can go find this information myself. And you feel even better whenever you can enact something that you took that initiative on, versus somebody telling you what you have to do. And so while things have looked a bit dismal in the healthcare realm this past year, I do feel generally optimistic that we are headed into this age where things are going to be opening up rapidly, and people are. And I think that's one thing we have seen this past year is the emergence of all these new health tech oriented companies and products and services. People are aware of how important our health is. Like that's the number one. If you don't have your health, you're not here. So people are understanding this on such a deeper level, and understanding the power that we do have. So I think for so long people have felt disempowered, because everybody in my family has had a heart attack and died before 60, and that's just what it's going to be for me. And if I'm overweight, I'm too, it's too expensive to get a gym membership, or I can't do this. And we've had such limited mindsets around what's possible. But I think we're now seeing through education, through innovation, through everything we have access to, that there's so much possibility, and we're just scratching the surface of it all.
Yeah, I think you said so many really insightful and brilliant things that I think are translatable to individuals who are trying to seek their way through, because life is confusing. There's no question about it. And I believe what's going on right now in healthcare is, if we look at young people coming into the discipline of the career in medicine, I'm doing this in a capital M medicine, there are certain people who like to know more and more about less and less, and they want to just drill down into the microscopic details of a specific topic. And that leads into a specialty medicine type of focus. And, you eventually can know more and more about less and less until you know everything about nothing. That would be the extreme example of absurdity. But that particular type of system or that particular kind of individual is a little bit different than the person who seeks to understand interconnections of many things at a higher level or organizational level, knowing that the forest is more than the sum of the trees. And so you have some people that are knowing more and more about the individual peach parts, and other people that want to know more and more about how the trees collect together to make a forest. Both of those are important learnings, and they both have different applications. And I think that what happens often in our system is that those who decide to go the route of knowing more and more about less and less, they end up being financially rewarded. There are more dollars that we deliver into the services provided by people who know more and more about less and less. And that's all based around the primacy of tertiary care and disease being the driver for the value proposition. If, however, we reconstitute or recontextualize that, saying that actually those people that end up in that tertiary care came from an environment that we needed to know more about how the trees connected together to make the forest, then we put a higher value on the people that are understanding forests, not just understanding trees. Now suddenly we give them the ability to make a gainful living, and we bring that system into play to lower then the burden on those that require to know more and more about less and less to treat the terminal diseases. So this is, in a broad econometric model, you need both components of this. But unfortunately, what we've done is we've reinforced financially only one side of the equation. So all aspiring people, when they go into the practice of medicine or the training in medicine, they say, well, how am I going to make a living? Oh, there's a lot more living to be made over here than there is over here, so I'm going to take this path. And then it just continues to perpetuate the model of disease care as being the primacy of medicine. So I think we're seeing a change in that now, because I think more and more people are recognizing medicine, as it relates to disease, didn't just come as a bump of the night unexpectedly. The combinations of gene, environment, lifestyle, and behavior, those four things coupled together to give rise to how we ultimately may wake up on a Monday morning with a heart attack.
Mm-hmm. Oh, yeah. One thing that you said that just keeps coming back to me, the forest and the trees, and, that interconnectedness, when people can see that, wow, I don't have to know every single individual tree out there. If I can have that bigger picture view and take action from that perspective, you cover the individual trees. So one thing that has been such a, I wouldn't necessarily say struggle, is I know it's going to be, and I know the IFM and people out there are doing the work, but how do we bring functional medicine more to the forefront, get it in schools? Like I can imagine if I would have known about functional medicine in medical school, I would have avoided a lot of pain down the road, but it's okay. I'm grateful for all that pain because it's serving me and everyone I serve today. But, how do we help the rest of the world, the rest of the up and coming doctors, the high school students in their health tech class who, like me at that point in time, I was like, I think this is it, but maybe not. Like, how do we bring functional medicine to the masses?
Well, I think there's different levels within our experience as humans where we're receptive. There are nodes of receptivity. We go through periods of our lives where we're just kind of comfortable what's going on, and then something happens or some event might be a precipitating event that triggers us for a self-reflection. And then we say, this is a node of learning, right? And we can pick up stuff really quickly. I'm thinking back with some humor to my own experience. I took a very, very sophisticated course in advanced synthetic organic chemistry. And I didn't get along with the instructor at all. And, he told my thesis advisor that I was a problem student. And And then one night, for whatever the reason was, I got over my aggravation about the instructor and I just got excited about the material. And all of a sudden, when I got that block out of the way, that was a node of learning, the material just swept into my brain. I mean, so fast. It was unbelievable. So fast that that same instructor, when he spoke to my thesis advisor several weeks later, he said, I don't know what happened to this Jeff Bland. He's like he had a brain transplant. That was the way that was the way he described it. That, I suddenly was now the best student in the class because I was receptive to learning, because I wasn't blocked by my aggravation by the instructor. So I think this is an example of what happens to many of us in our lives, where we have to be ready at that moment to learn something, and then it becomes a transformational process, and we can't go back. I've often said to people who ask me about functional medicine docs that I'll meet, and they'll say, "So tell me about functional medicine," and I'll say, "Well, I'd be happy to tell you about it, but let me tell you, if I do that and you listen to me carefully, this will be like a virus that gets in your nervous system that you can't get rid of. So you have to be willing to accept getting infected. If not, then I probably shouldn't say anything about it, because I'm telling you, this concept has an inherent truth about it that will make it very infective. And you might have some sleepless nights after I've, infected your mind with this thought." And I say that somewhat humorously, but it's actually quite true. I mean, let me give just a little of the mini anecdotes. This is a lot of years ago. This is early on in functional medicine history. I was asked to give a talk up in Calgary by one of our early functional medicine doctors who had quite a good practice in Canada, functional medicine practice. And he had, I think, 10 physicians in his practice. Not all were functional medicine practitioners. And so he invited me up. He said, "Jeff, I'd like you to speak to the community, but I'd also like to get my colleagues in to hear you speak, because some of them are not yet kind of transitioned into functional medicine." I said, "Oh, sure." I went up and I gave the lecture. And at the start, he introduced me to one of his young colleagues. He was an older gentleman. This was a junior doc. He was very pleasant, but I could tell he really wasn't excited about being there. It was kind of like, okay, I'm here just to fill a space and be a courtesy. And so he then hung in to the first break, and then I was actually surprised to see him. He had come back after the break, and he continued all the way to lunch, and I thought for sure he'd be gone after lunch. But no, he stayed the whole day. So I lost touch with him, and something like 5 or 6 years went by, and we were having a functional medicine meeting in Tucson, Arizona, one of our annual meetings. And it was a break time, and there were a bunch of people in the foyer, and he came up to me, and I recognized him like a missile, just going right at me, and came right up in my face, and he said, "So Jeff," he said, "do you remember me?" And I said, "Well, yes, I do remember you, but I'm sorry, I don't remember your name." He reintroduced himself. He said, "Do you remember that seminar that I came to?" And I said, "Yes." And he said, "I really just came as a courtesy, and I didn't really want to be there. And, I thought this was completely out of anything I'd be interested in, but I was kind of interested, and I got more interested over the day. And then I got home, and I went in, and my wife saw me as I walked in the door, and she said, 'Oh, my word, what happened to you?' And he said, 'What do you mean?' She said, 'Well, you look entirely different right now. You've got that light in your eyes. You've got that infectious look that you had when we were first married that brought you into medicine, and all through your early training. And you really look enlightened.' He said, 'Well, I guess I really am kind of energized, because this was a really interesting experience I just went through.' And then he said, and then she says to me, 'Well, whatever just happened to you, you should do more of it, because this is the husband that I know resides within you. This is the person who has the love of what they're doing. You need to do that.' And as he tells me this story, I'm not exaggerating, this 55-year-old man breaks down in tears and throws his arm around me and hugs me and says, 'You gave me back why I went into medicine.'" Now, what do you think that says about what we're doing? What it said to me, I can tell you, it's a pretty powerful experience. You can just tell with the energy and way I'm describing it. And I've had the privilege of having that happen. Maybe that's the most dramatic, but similar experiences, literally probably hundreds of those experiences over the last 30 years. So there is something about an essential truth in what we're doing here that is worthy of all the angst that we put up with.
I literally had chills on my arms and legs hearing that. 'Cause it's so, I mean, I didn't know about you when I first started my journey, but I have that same sentiment towards just the IFM as a whole. Like the IFM has given me back my purpose in medicine, and knowing that I can still have that light in my eyes and not have my soul just dragged and torn apart being a part of a system where I didn't heal the whole person. And knowing that, we have something so powerful that when people first get a taste, we know that, the movement is growing, the more people are coming. Like it's an inevitable truth that this will be standard. Uh, and short of giving people brain transplants to get it out there more quickly, or like you said, a nervous system virus. I mean, I think the work speaks for itself for sure. And all the hundreds of people who've come to you in gratitude, myself included, it's I know that for the rest of my life I will be an evangelist for functional medicine, because it's changed my life and everybody I've had the honor of serving. I just speaking with a patient earlier today who I hadn't seen for about 6 weeks. And she, like, the second that she got on Zoom, I could see that light at her face. And I hadn't seen her look this radiant ever. And I was expecting to hop on a call with her and we have to troubleshoot some things and put out some fires. And here she was telling me that this is the best she's ever felt. And I haven't done anything in a long time with her. Like, she's taken what we've done, she's put it into action, she's figuring out her body, she's learning herself. We are not a black box. Like, we have all of the ability within us to be able to understand the unique makeup of our body without having to understand the biochemistry. Like, we should, all humans have that intuitive connection to ourselves, and functional medicine helps connect people back to that part of ourselves that we've just lost touch with. And it's such a powerful gift that we get to share.
Well, you said it beautifully. And I guess I'd like to add one kind of closing comment, and that is, in my earlier years, this is way back when, I wondered if I shouldn't have gone into some kind of more mechanistic form of medicine that would save lives, and I could see that I was saving lives, that, because that would be a huge sense of pride that you had given that person their life. And what I recognize now, and this is a message I'd like to really transmit to every one of the functional medicine colleagues today and tomorrow, is that over the last 40 years for me, following this path, I have had innumerable, I couldn't even begin to tell you the number, but let's just say innumerable people who have come up to me and said, "You saved my life." Now, I didn't do it by surgery. I didn't do it by any kind of pharmaceutical intervention. I did it by the power of ideas, by giving them some sense of hope, by giving them tools that they could work with, and giving them the proper guidance principles that derive out of systems thinking about healthcare. And so by a different path, I achieved my goal that I hoped that I would be able to do when I was a younger man, a younger person, that I could help people to save their lives. And anyone in this field, if you stay in this field and you serve the field well, you will have many of those experiences, because saving a life just doesn't happen in the emergency room alone.
Ooh, wow. I don't know if there's much to say after that. It's one of those mic drop moments right there. The mic,
Yeah.
drop it.
Well, thank you. This has been such a privilege and treat to share these thoughts with you and to see where you're going with your glorious, illustrative career that will follow. So thank you.
Oh, thank you so much, Dr. Bland. This has been incredible. I guess the vision that you had even before I was alive it's growing even more beautifully every moment of each day. And the ripple, I see this ripple effect occurring. And I mean, we're creating the change that this world needs. Like we're all part of this revolution that the world needs, and not just America. Like this is a worldwide movement, and not just medicine, and just healing of all humanity. So it's pretty powerful.
It's really powerful, and they have people you in this like you in this movement. I know it has a good place to go. So thank you.
Oh, you're welcome, and thank you.